to talk your health, and it's the new year, 2018. A lot of people are trying to lose weight, feel good, and figure out what's going on with me. I've been working out, I've been eating right. You hear this all the time. We got Angela DeRosa here, Dr. DeRosa. She's the founder of DeRosa Medical. You can go to DeRosaMedical.com to get more information. But we want to know, because women especially probably don't even think about this, but your thyroid actually could be making you fat, despite the fact that you're doing everything to lose weight and get in shape.
Certainly. So when you think about it, the thyroid sits here in your neck. It's a teeny tiny organ, but it's probably one of the most important organs in your whole body because it is the engine of your body. So imagine if you slow down the engine of whatever car you're in, you're going to not perform as well. So when you slow down the body, you're going to see weight gain in particular, which or an inability to lose weight, despite all of the efforts you can do with dietary changes and exercise. But also you start to see hair loss and hair thinning, which women really get distraught over. We start to lose our eyebrows, our eyelashes, our skin gets dry, our bowels slow down, so we start to see constipation or bowel changes.
It affects everything.
Everything, even our mood, so we can even become depressed from it. But this time of year, as we're really focused on that ability to want to lose weight, if you those resolutions we're all striving for, if you don't address thyroid balance, you could be potentially putting yourself behind the 8 ball and not even know it.
So you say thyroid balance. So is this something that I'm sure a lot of women just neglect to even think about? What do you need to do when you go to get checked? I mean, how do you even start that conversation?
Well, a lot of times doctors are going to wait till your thyroid is overtly failing. So in other words, that you have a true condition called hypothyroidism, which means the thyroid itself is not producing enough thyroid hormone. But sometimes it can become suboptimal, meaning it's still functioning, but we want to bring it up to optimal states. But there's other breakdowns that can occur as well.
We have a picture here, so this diagram is showing us the little breakdown and what's good and what's bad.
Yes, so most physicians are going to check the hormone you see on the screen, TSH and T4. That tells you specifically, is the thyroid producing enough of the thyroid hormone? But in our clinic, we take it even a step further, because the thyroid can actually produce enough hormone, but if you don't convert it to its active hormone, which is actually T3, which is not on that diagram, that's the one that goes in the cells and does all the work. So you have to check T3 as well. So if you don't get enough of that T3 into the cells, your body's going to function and feel hypothyroid.
So are we talking that a woman would have to get some kind of surgery done?
No, not. So typically when you're hypothyroid, which is the most common, meaning too little of thyroid hormone in your cells, hyper is the one that's too active and sometimes may involve surgery. But usually when it's too low, we actually just replace it with thyroid hormone. And there's bioidentical versions-ish of thyroid, like Armour thyroid, Nature thyroid. There are more synthetic ones called Synthroid and Cytomel, which can also be helpful. But we need to determine where the breakdown is so we can prescribe the right one for the right patient.
And once you get on this, does it take a while before you actually start to see results?
Not necessarily. Most patients, on average, will start to see feeling better and better results with overall health within 3 to 6 weeks. So we're talking a short period of time. And then if we don't have the doses quite right, it may take a little longer. But on average, most people start to feel pretty good, and it may take a little longer to get it just right. But typically we see really good results real fast.
So when a woman comes in and she has the questions about her thyroid, how long is the process? Is it like within a week that you can diagnose and say this is what you need and then get them on that path to make the changes?
So typically a female or male, men suffer from hypothyroidism as well. We have them come in, we do a full physical exam, because I can look at a lot of women just by looking at their eyebrows and looking at their thyroid. So doing a physical exam can give us some really good clues. We want to also look at your vital signs. Are you heart rate slow? Is your temperature low? Those are things that can give us clues. Then we check blood work, and typically within, say, 2 to 3 days, depending on your lab, we'll get those blood work results back. We have the patient come back, we review all of your results, tell you what went wrong, and then we're going to tell you how to fix it.
Nice information. I'm telling you, she always points us in the right direction. We want to have a good 2018.
Absolutely. Get that
and all
fat
that
off.
hard work that you're putting in, you want to know why you're not losing weight? It could be your thyroid. So again, take and get a hold of Dr. DeRosa. It's DeRosaMedical.com. We'll have a link on our website, aztv.com. Here's the news right now with Catherine.